Kathe Stark earned a Master's of Science degree in Applied Psychology from St. Cloud State University in Minnesota and moved to Las Cruces in 1997. She was the city's first Americans with Disability Act coordinator and then served as acting risk manager, assistant to the city manager for internal operations and human resources director. She also worked in human resources for the Doña Ana Community College, Doña Ana County, and was co-owner of 2K Compliance and Training, which provided HR and operational consultations and training to cities, counties, and private medical practices. As co-founder of Animal Advocates for Change, she completed extensive research of best practices in animal care and control and conducted public outreach and advocacy development, and drafted and advocated for the city's new animal ordinance. Currently, she does trap and release to control the cat population and cares for community cats. She has won several awards for gourd art and pine needle weaving. Joanne Turnbull, PhD, earned her PhD social work and psychology from the University of Michigan and an MFA in creative writing from the University of Southern Maine. She has practiced as a psychotherapist and taught marital and family therapy and advanced clinical practice in the Department of Psychiatry at Duke, the Schools of Social Work at University of North Carolina, Columbia University, and University of Michigan, and held senior administrative positions at Duke, the University of Pittsburgh Medical Center, and the University of Texas Medical Center. She is Executive Director Emerita of the National Patient Safety Foundation. Joanne has published numerous academic articles, short fiction, and an award-winning essay. She was awarded a Healthier Communities Fellowship by the American Hospital Association and co-authored To Do No Harm, Ensuring a Culture of Safety in Healthcare. She is co-founder of Patients Primero and chairs the Healthcare Committee for the League of Women Voters of Southern New Mexico. So with that, Kathe and Joanne, please take it away.
Hi, everybody. And Kathe, I think you'll switch the slide and so we can begin with who we are. We're really glad to be here today. You are so important in carrying the message forward, and we need just a little bit of background about us. You heard all the academic stuff, but Kathe and I met at it'll be a year in March, but the first one is a core belief as well as who we are, because we're all patients, or will be if we're not right now. And used to joke that the only people who were satisfied with the healthcare system were people who were making money from it or weren't using it, because things are difficult for practitioners and for patients. We believe that everyone deserves access to quality healthcare within their community, that no one should have a baby by the side of the road or have to go 4 hours to a hospital. But Kathe and I attended several listening sessions with the Doña Ana County Medical Society and met at one that had been organized by my physician, who is also the president of the Doña Ana County Medical Society. And he had said something to the effect of, he has a waiting list of 400 patients, first of all, which gives you a sense of the access issue. But he said, boy, if I don't get this listening session organized, I'm going to lose all credibility. So a couple of people helped me organize it, and that's where I met Kathe. Somebody was sitting next to me and said, you need to talk to that woman over there. She's done amazing things in the animal world, which is true. So we did, and here we are. We recognized and believe that physicians are dedicated to providing quality care, and the existing laws that in New Mexico make it difficult. It makes it difficult to retain physicians now, which is why we have a shortage, and to recruit them. So we decided to get involved, organize, collaborate, and speak up. And we have. I think we have, what, 611 followers now, Kathe?
Combined, we have 1,000 people.
1,000, wow.
Yeah.
And so our goals are basically to educate the voters, people who vote our legislators into office, about the factors that are driving the provider shortage. And we believe that if people are educated about what's happening, they're going to do the right thing. We also work to create partnerships, to create strength that will increase access to quality healthcare. This would be a good example of a partnership here, talking to you guys. We also collaborate with legislators to enact comprehensive legislation and to balance the healthcare environment. And finally, we want to change the narrative. I don't know how much you hear about this in your practice throughout the state, but it very easily turns into doctors versus trial attorneys. And that's not what it's about. It's about patient access to quality healthcare and safe healthcare. About the crisis, for 5 years, 2019 and 2024, New Mexico lost 248 practicing physicians and of primary care physicians, which would be 8.1%. Nationally, the number of general practitioners increased by 7.3%, or 44,272. We are the only state in the nation to have lost physicians in 2024. We have a couple of other distinctions you'll hear about as we talk, I'm sure. And between the decade of 2020 and 2030, that shortage is expected to double. And one reason is that we have the oldest physician workforce in the United States, and 39% are over the age of 60 and expected to retire by 2030. So, and the U.S. Department of Health and Human Services has classified 32 out of 33 New Mexico counties as underserved with professional health shortage things. So basically our goal is we need to build an environment where patients have access to quality care, when physicians want to practice in New Mexico in order to meet the needs of patients. Okay.
We believe what doctors have told us. And one of the things when we went to the listening sessions, it was clear that at least some of our legislators are not listening to physicians. We are. And physicians have identified several barriers that they face trying to recruit and retain healthcare providers, including our malpractice premiums, which have increased 40% since the malpractice law was reformed in 2021. Our law in general on medical malpractice needs significant work. We are now the only state that charges gross receipts tax on healthcare services. Hawaii used to, but as of January 1st, they eliminated gross receipts. And that's a tax that can't be passed on. Like in stores, when you buy something, you pay the gross receipts. When you go to a healthcare provider, they have to pay the gross receipts. And then with the exception of the nursing compact, which New Mexico joined in 2003, we have failed to join the interstate compacts, which would provide access both in person and via telemedicine to specialists or physicians in other states which are part of the compact. And then our reimbursement rate. The medical malpractice reforms being discussed are to raise the legal standards for punitive damages and cap them. Currently, the legal standard is preponderance of the evidence, which is often described as the feather test. If you have the scales of justice and they're balanced, someone drops a feather on one side and that makes the decision. The proposed reform is to raise that to clear and convincing evidence that it's more likely than not that whatever act is being alleged actually happened. Secondly, to prohibit stacking of lawsuits for one incident. And by that, we mean something happens in the OR, for example, and a trial attorney will try and file a malpractice suit against the surgeon, against the anesthesiologist, about the surgical tech, trying to increase the caps that are on damages other than punitive damages. And what we are advocating for is if it's one incident, it's one lawsuit that can be brought forward. Then capping attorney fees. 20 other states cap attorney fees. Currently, attorneys in New Mexico, or those who are from out of state, and we have many of them filing these lawsuits in New Mexico, are generally taking 40% of any award. And what we and Think New Mexico are saying is no, the patient should be the beneficiary of any reward. And so the proposed reforms are to cap attorney fees at 33% if you settle a case, because it's a lot less work to reach a settlement than it is to go to court. And if you go to court, that the attorney fees would be capped at 33%. We're out of balance with other states who have addressed this issue. Then the next item is lump sum payments. The system in New Mexico with the patient compensation fund ran for years and years and years on a pay-as-you-go system. The patient who was harmed incurs an expense, they turn it into the PCF, and they get compensated for that expense. In 2021, with the reforms, that ended, and the patient would get a lump sum payout. So why would we object to that? Well, the first reason is the attorney's going to take their 40% right off the top. So let's say when there's an award and they bring in an actuarial who's going to look at the patient, they're going to make an estimate on how long that patient's going to need care or how long that patient's going to live if they need lifetime care. So let's say they look at me and they say, well, you maybe have another 5 years. And so the award is based on that projected. But I live 10 years. Now I've been put at risk because my ongoing medical expenses are not going to be covered. Where with the pay-as-you-go system, my expenses will continue to be covered. And the attorneys don't like that because number one, they don't get their percentage off the top. And number two, when I receive compensation for whatever expense I have submitted, the attorney needs to come back to me and say, hey, Kathe, you owe me 40% or 35% of that. And so they object to that. Stopping venue shopping, what that means is, for example, there was a lawsuit against the hospital in Gallup, and the lawsuit was tried in Santa Fe. Why would you try a Gallup case in Santa Fe? And there are those who will tell you it's because Santa Fe juries are more generous and they're easier to sway to make an award. There are others who say, well, we're filing in Santa Fe because the judges there are much brighter than they are in other parts of the state. What we're saying is, and this is the Think New Mexico plan as well, which we are supporting, is that if it happens in Santa Fe, the trial should take place in Santa Fe. If it happens here in Doña Ana County, the trial should take place in Doña Ana County. And if there's a valid reason that either side believes they cannot get a fair trial, then just like in criminal cases, you go to the judge, you make your case as to why you believe that's not true, and the judge decides whether or not that case can be moved. And then the final one is to base future medical costs on the actual cost of care. I'm sure you're all aware of the charge master sheet, and you're also aware of what actually gets paid either through Medicaid, Medicare, or negotiated insurance rates. What has been happening is that future medical costs are being paid out of the patient compensation fund at the charge master amount, which is number one, they're going to deplete the fund, and number two, far exceeds the actual cost of care, which is what we're trying to compensate. And so what are the goals? We want to achieve balance. We are out of balance with states around the United States. And this all happened in 2021 with the reforms that went through the legislature. They caused a great deal of harm and consternation, and it took 2 more bills to correct that harm. But we still remain way out of balance. We have more lawsuits than any, well, we're second in number of lawsuits. We're number one in the payouts over $500,000. Other states have addressed this, and Think New Mexico has looked at those states and proposed these proposed reforms. We want to make sure that patients that are harmed are protected, that they get the largest share of any judgments or settlements, because that's what the jury is awarding. We want to create an environment that supports healthcare providers, in particular independent healthcare providers, because what is happening to independent healthcare providers is they are being burdened with so much financial debt when they pay their malpractice premiums, which are more than twice our surrounding states. They have to pay the GRT. They pay into the patient compensation fund. And yet their income coming from Medicaid, Medicare, and our small percentage of private insurance is not going to cover those costs. So then what happens? So an independent physician is faced with the choice. They can retire early. They can leave the state. They completely can stop practicing medicine and go and do something else. Or they join one of the hospitals. And many of our hospitals are owned by private equity. Private equity isn't the enemy here. Private equity is the end result of a system that is putting undue strain on independent healthcare providers. We want to allow attorneys to conduct a viable practice without putting injured patients at risk. If you've ever had to deal with litigation, you know that attorneys play a valuable role. This isn't about saying, we should do away with attorneys, because they're a necessary component. And the bottom line is, by doing all of those reforms, we want to increase and protect everybody's access to healthcare. If you talk to any physician that's been trying to recruit physicians, they'll tell you these are barriers to their ability to get providers to come and to get providers to stay. So gross receipts tax, and you'll see I struck out Hawaii this morning since they now eliminated their gross receipts. What's being proposed is to eliminate it from health services. We're now the only state that charges it. We can't pass along those costs, and that tax ranges from 5.25% to 9.45%. Almost 10% is a huge hit on the revenue stream for providers. Now, this is tough. It passed the legislature last year, but it passed after the omnibus tax bill was passed. And so when it got to the governor's desk, she said, I have to veto this because you haven't found a way to fund it. And so we anticipated it's going to be on the 30-day session. And there has been some talk about the state eliminating their portion, which is 5%, but leaving the municipalities' portion intact, because municipalities rely on that money in their general fund to fund the services that they provide. We have been advocating and pushing that the state join the other interstate compacts, which recognize the medical license by other states that are a part of the compact. When a physician from another state in the compact practices medicine in New Mexico, they're governed by New Mexico laws, so that's not an issue. And 40 states and the District of Columbia and the Territory of Guam participate in the medical license compact. When we don't participate in the compacts, and I will give you an example that's in the Think New Mexico report, and it's a couple in Albuquerque that had a child with a very rare cancer. The doctors in Albuquerque had said they were going to have to amputate, I believe it was the hand, if not the whole arm. Suggested they get a second opinion. So they found a pediatric oncologist in Texas that would consult with them until they found out that we're not a part of the interstate compact. So they said, you're going to have to bring the child to us in Texas. Of course, the oncologist in New Mexico is saying this child cannot be put on an airplane or on a train because they're immune compromised because of the treatment that they're getting. So what this family does and has continued to do is they drive down from Albuquerque, they cross the border into Texas, then they get on the phone with the oncologist from Texas. And the child has not had to have their hand amputated. There are 10 healthcare provisions that have compacts. New Mexico has only adopted the nursing compact, which we did in 2003. And the reports on the results of that is how outstanding it has been, that 80% of our nurses, particularly in rural hospitals, are there because of the compacts. And we are the only state in the 5 states that have the only of 5 states that have adopted fewer than 2 interstate compacts. Now, bills are starting to be pre-filed with the legislature. There's 3 compact bills that are being proposed currently. We're anticipating the physician compact bill will be introduced and will pass. It's had to go through a lot of work with the working group, with the Senate Judiciary. And there's some question of whether or not the social work compact is ready to come forward this legislative session. But we're going to be making our voices heard that this is critical in order to increase access to healthcare and also to provide practitioners in New Mexico to be able to refer their patients and work in kind of a triangle with the patient, the physician here, and the physician or the healthcare provider in one of the other states that's in the compact. Then reimbursement rate. So this is the tough one because approximately 40% of New Mexicans are insured under Medicaid. 21% are insured under Medicare, and neither one are intended and neither one do cover the full cost of treatment by our providers. Last session, Senate Bill 88 created a permanent trust fund, and the state has a number of trust funds. And it would receive recurring revenue until it reached $2 billion, allowing the state then to increase the rates it pays to providers for Medicaid. And the goal was to get it to 150% of Medicare reimbursement to physicians. Unfortunately, the big, beautiful bill out of Washington rolls that back, and New Mexico cannot achieve the 150%. So that's something that's ongoing, that they're looking at how they can continue to increase the funding in this trust fund in order to increase reimbursement to our providers. You're muted, Joanne.
Yeah, I just, typical mistake.
Yep.
Thank you. You must know, most of you, that we have a second, on the even years, we have a 30-day legislative session. On odd years, we have a 60-day legislative session. So in this 30-day legislative session, it's supposed to be limited only to budgetary issues, and then anything the governor calls and says, I want this on the agenda. And so we anticipate there'll be a GRT adjustment and the interstate compacts will be on the agenda. Not all of them. And that's what we're advocating for now, is we're writing as patients Primero and encouraging everyone to call, write, email your legislators and say, endorse all 10. There's no reason not to do that to increase access. So there may be some discussion about medical malpractice, but this is going to be the toughest one because our legislator has many or several trial attorneys in very prestigious and powerful positions, like the Senate Judiciary Committee, that sort of thing. So we will get some talk about it, but it's not likely to pass, and we hope that's a big deal. We have to. There's also talk about the spring special session to address medical malpractice. I don't know if that's going to happen or not. I heard that from a lobbyist for the State Medical Society, and Kathe went through the things about medical malpractice reforms, and capping attorneys' fees is not popular, nor is, the sort of lump sum payment. Getting rid of that's not popular. So there's going to be a lot of hard work around that issue. Did I miss anything, Kathe?
No, I think that's where it's going to kind of depend on the governor, because the governor at the end of the last session said, medical malpractice is the biggest issue keeping us from retaining and recruiting physicians, and that something needs to be done. So the ball is in her court. She did hold a summit where she called in the physicians and the trial attorneys and some of her department heads. And it's a little unclear. When you have your presentation tomorrow with Think New Mexico, maybe they have more insight as to what all came out of that. There's been a lot of testimony at the interim committee meetings that something needs to be done. It's just going to be a tough hill to climb. I think it's doable. They're hearing from patients and from physicians and residents and interns all over the state that something needs to change, and it can't wait because we are in crisis, literally crisis. I have a physician who asked me what I thought was going to happen, and I said, you don't want to know. And And she said, yeah, I mean, I think we're in such trouble that we're starting to go off the cliff, and that we can't have that. And you'll see some of the impact next. So patients Primero, when we started, because I'm the data nerd.
Thank you.
Data. We did a patient survey and we had it on our Facebook page. We dropped it off at physician's office. We asked physicians to send it out on their portals to their patients because we wanted to be able to tell legislators that as patients and as voters who put you in office, this is what we're facing. So 41% of Doña Ana County residents reported having trouble finding a PCP. 60% have trouble accessing specialists. 53% report wait times are 2 to 6 months. I mean, I just saw the letter from UNM Dermatology that they're a year and a half, 2 years out, and they're trying to use telemedicine and kind of pop-up clinics to address that wait time. 60% of the respondents have traveled out of state for healthcare. Now, one of the things that a legislator said that just and I have responded to her. She said, you know, this has been a growing problem for 10 years, but now that it's affecting the middle class, they care about it. And I really took offense to that because Patients Primero and Joanne and I personally, we understand the socioeconomic makeup of our population and that we have 40+% on Medicaid. They don't have the privilege that Joanne and I have, for example, to be able to go to Arizona or be able to go to MD Anderson, and that we have and will continue to have patients who will die because they don't have that privilege and we don't have providers that we need to have. In that survey, it also said 45% knew somebody who left New Mexico because of the lack of health care, and 37 knew somebody who didn't move here because of the lack of health care. So, sorry. So that has larger economic ramifications for the state that legislators need to understand. If you have people leaving, they're selling their homes, they're not supporting businesses, they're not paying taxes. And when you have people not coming, it's, you know, it's the same thing. It's a loss to the economic security of the state. When we recruit and retain physicians, they also get invested in their community. They buy houses, they support businesses, they pay taxes. So this is, you know, in our opinion, a much broader issue that the state needs to recognize, and they need to take the steps to address it. I'm going to pause this here because both Joanne and I have stories that we want to share with you, and I'll back this up. And to illustrate what we're hearing from patients all over the state. John, do you want to go first?
Sure. And to add what Kathe said about economic impact, which we don't think about like the really indirect effects, we met with the Community Foundation of Southern New Mexico. They've lost their docents because those people are volunteers and they've left the state. Their donations are down. So this has really broad impact, as Kathe said. So I could tell you a lot of stories. I'll begin with my own, that on October 9th, I had surgery at Mayo Clinic, that I'm one of the really fortunate people, but I had to go in debt to do that. It was $15,000 out of pocket. There was travel, there was place to stay, there was my daughter, who's a nurse, came to be with me, and her employer gave her FMLA, family medical leave, but did not pay her salary, and she's a single parent. But I know that I'm really fortunate that I could do that at all. Another story is a young man, he's in his late 40s, who was waiting for a transplant and could not afford to go up to Albuquerque and died. He just couldn't afford to go up and do the care that was needed up there. So And Kathe, I don't know if you're going to talk about the patient who the dentist in Ruidoso told us about. Were you going to talk about that?
Yeah, I'm going to talk about him because that one just sticks with me and I wake up at night thinking about him.
I know. Go
He's
ahead.
born and raised New Mexican, lives in rural New Mexico, west, not too far from Silver City, actually. And he was not feeling well. And so he went to his primary care physician, who happened to be a nurse practitioner. And I don't ding nurse practitioners because they play an important role in our healthcare system, but they are not trained the same as the physicians are. Saw the nurse practitioner who, to her credit, said, "Whoa, this is way beyond my training and my expertise. You need to see a cardiologist because I've never seen blood pressure this high. So let's put you on the 12-month waiting list for a cardiologist." 12 months. In the meantime, he was referred to an optometrist because with that blood pressure, he's starting to having sight problems. And the optometrist says, of course, this is way beyond my expertise. You need to see an ophthalmologist. Goes to the ophthalmologist. Now, this is months and months waiting for these appointments. Goes to the ophthalmologist who says, well, you need a specialist ophthalmologist. And so you need to go to Albuquerque, which is more months waiting. In the meantime, he goes blind. And he doesn't think any of the providers did anything wrong. They didn't. They did the best they could within the system that we have. But what he will say is the worst part of this is that he will never see his grandchildren because he's now blind. And that living in New Mexico should not be a death sentence because we don't have access to care. And that one just breaks my heart. And there are more. But I wanted to give everybody an idea, and I'm sure you've heard this from patients all over the state. And it's very tragic and needs to be addressed. So how do we address it? We make lots of noise, lots and lots of noise. Elected officials really do want to know what you think. You want your input. They may not agree with you, they may argue with you, and that's fine to have those discussions. But we have an advantage in New Mexico because we're relatively small and it makes our legislators more accessible. I run into legislators at the grocery store. I send an email to a legislator and say, can we have lunch? Can we talk? And very few times am I turned down. When you contact your elected officials, they know that you care, that you're watching them, that you elected them to act on your behalf. And they need the input. And we need it in large numbers. In the special session that just happened, we had one legislator, and he's part of the leadership team, who was kind of perturbed, but he got the message. And he was telling people he got over 3,000 calls from constituents to get us in the compacts. Well, he has since backed off his opposition to the compacts. We had another committee chair who was about in tears because she said, I can't even go into the grocery store without constituents coming up to me and saying, what are you going to do about this? You have to fix this. We voted for you and we'll vote you out if you don't. So numbers count, make noise. You want to connect with legislators, communicate, learn as much as you can about the issues and share that with them. And then collaborate, which is what we're trying to do with every group that we're talking to, because there is power in numbers and we amplify the message that we're going to hold these elected officials accountable. And we encourage everybody to do that. So how to do it? That's a question we get a lot from residents. Meet with legislators. It's going to be hard now. The session's going to start. So then call them, write them, email them, ask them about the particular issue that you're advocating for. When legislators get a large number of phone calls, they know it's important, and they now all have legislative aides who's tallying up the phone calls, who's going through the emails and going through the letters. and then feeding that information back to their legislators. If you're doing letters or emails, you can go to the Think New Mexico webpage. They have an action center where they have template letters. And what Fred and Christina from Think will tell you and what we will tell you is don't send that letter just as it is on their webpage. Make sure that the first paragraph that you write is personal. What are you personally experiencing? What are you hearing from patients that you serve? Because if they get letters that are all identical, they just go in a pile. They may be counted, but they're not being read. So make it personal. Be courteous. I'm having a hard time with that these days, but I try. And always say thank you. Questions you want to ask legislators is what do you know about the shortage? Because by now they've been hearing a lot. They should know a lot. Ask them, what are you going to do about it? And there are lots of proposals out there. Think New Mexico has their 10-point plan. There's other ideas that have been floated. Ask them what they're going to do. Ask them where they get their information. If you go to patient-led New Mexico, which is out of Albuquerque and financed by the medical societies there and the hospital association, they will show you some information about who's gotten what amount of money from the trial attorneys. So if they're getting their information and their money from the trial attorneys, we want to challenge them. This next one is just huge for me. It's have you talked to providers? I talk to legislators and they're like, well, I heard from this patient or I heard from this attorney or I heard from this legislative colleague. And I'm like, have you talked to providers? Are you listening to providers? They're in the trenches. If you had a problem with your car, you wouldn't go to your physician and ask them what to do about the problem with your car. Well, if you're having problems accessing healthcare, you wouldn't go to your car mechanic. You're going to go to your physician. And legislators have not done a good job of listening to physicians, which is one of the main impetus of how Joanne and I and Patients Primero came about. It's like, if they're not listening to you, we're going to make enough noise and hopefully they'll listen to us. And then what are you hearing from your constituents? Let them tell you the pressure that they're feeling. And then you can say, good, I'm glad you're feeling the pressure and I'm glad I'm adding to it. Because we really need everybody's voice. If you want to be on our listserv, and we encourage you to do that, just send us an email. We're on Facebook. We have a web page. And then definitely watch Think New Mexico's Take Action Alerts. Read their report. You can download it from their webpage. It's well researched. It's focused right now. It's a 10-point plan. It's focused right now on the key issues that we went over today, because those are the most pressing before we can move on to other issues. There's a legislator in the Senate Judiciary who said we need more residency slots. And I met with him and I said, yeah, we do, but we need doctors to continue to supervise and train those residents. And with a shortage of doctors, we lose the opportunity to train the doctors that we definitely want and need to train, and we want them to stay here and provide services to New Mexico. So with that, we'll ask if you have any questions and we'll try and answer them.
Thank you so much for sharing the patient stories. I think that the impact, just bringing that across is important and something to always think about.
Well, we're working with individual in Santa Fe, Las Cruces, Albuquerque, Jemez, and one of the things that we're coordinating with them is collecting all these stories. And an individual from Santa Fe is now working the hallways up at the legislature and will be carrying these stories with her because there are just so many.
And I do think that they are listening. I was thinking about how busy you guys are with all this. I mean, emails don't take a long time. And you can get the legislators email address. Yeah, you'd be surprised. One of the things I've learned, and I was probably guilty of this, is a lot of people don't even know who their legislators are, who their state senator, who their House of Representatives are. And you can get that on the website, look it down, get their address, and shoot off an email. And they are listening. There's things like Kathe was talking about the legislator who changed their tune on the compacts. There's no reason for us not to belong to these compacts. But a year ago, and less than a year ago, they didn't want to do it because, quote, New Mexico would lose its sovereignty. And trial attorneys couldn't sue the commission. That's changed. I belong to the League of Women Voters. Last year, one legislator showed up. This year, there were 10. And people pounded the table when healthcare came up. So they are listening, and our voice is really important.
And I think it's particularly important for them to hear from providers in training, whether they're still in school, they're in their residency. They really need to hear from you, because we need you to stay and provide the services that you spent so many years being trained to provide for the patients. That, I mean, physicians care. When we went to the first listening session with the medical society, they had just come back from the 60-day session, and they were just beat up, basically. And you could see it because they went into medicine because they're dedicated to serving the health needs of their patients. And when they're being prevented from doing that, and they have wait lists, I mean, there's one physician that's got a waiting list of 400. I regularly get emails from him when he's just gone home from work at 9 p.m.
Yeah.
They're running as fast as they can, trying to provide services to as many people as they can. There's just not enough providers.
And they can't recruit them. You know, there's the physician that Kathe's talking about, his wife runs the practice, and she said she talked to a recruiter in Dallas and said, we have trouble getting physicians to come to New Mexico because of all these things that you heard about today.
Right.
I'm hoping you guys have some questions.
Well, we appreciate the opportunity.
Yeah.
And hope that we've helped kind of highlight the issues and why we're advocating for what we're advocating for, and why we are supporting the Think New Mexico proposals.
Thank you. Like some of us will be on legislative month next month, right?
Mhm.
Yeah.
So this was a good primer, I think, for the second years who will be hearing a lot of this for their legislative block starting
Awesome.
off. I think,
Good.
yeah.
And January 28th is White Coat Day up at the Capitol.
They'll be there.
Awesome.
Okay, if our second years reach out to that email if they're thinking about advocating and maybe working with you guys, because part of the rotation is they have to kind of pick something to advocate for, and they can work with pretty much anybody, you know, Think New Mexico, that type of thing.
Right. Well, and if we get people signing up on our listserv, in fact, I'm just drafting one that I'm going to send out now to everybody on the listserv, with just how to navigate the legislature, how to find your legislator, how to navigate it, how to get heard, and then what we're going to be doing along with Think New Mexico, because you can sign up for updates from them as well, is during the session, just trying to pump out information, like here's a hearing date, here's some talking points, here's the time, here's the place. If you're in the area, please make your voices heard. And if you're not, they do take public testimony via Zoom. The downside of that is you never know how the chair of a particular committee is going to manage the public input. Last 60-day session, when it came to medical malpractice, the chair was like, okay, I'm going to take 3 people in favor and 3 people opposed. That's not a lot of people.
Thank you.
Thank you.
Are there any other questions or comments before we just quickly wrap up here?
You have to be careful with Joanne and I because we can go on and on and on and talk.
Oh, and maybe I'm making an atonement for when I was so busy working and had kids and I did not know who my legislators were. And I think that's how we got there, as people like me. And I think there are ways when you're so busy that you can be informed. Kathe mentioned the listserv. That's one way, because we don't send out stuff to waste your time. We send out stuff that, please pay attention to this and if you can do something. So that's a quick way to do it.
All right, well, thank you so much for all this information. I'd be happy to send out the slides or anything to anyone that wants to follow up. But other than that, thank you all for being here, and thank you, Kathe and Joanne. Really appreciate your presentation.
Thanks for the opportunity.
Yeah, thank you. And thanks for the work you do.
Yes, thank you. Thank you. All right, bye, everybody.
Bye-bye.
Bye.
Thank you.